do know that there's something common amongst us as clinician educators, that it's not as if we have free time. And if you are going to tell me you have free time right now, you're lying, and maybe you're lying to yourself a little bit. But we're also really emerging as a very valuable phenotype in academic medicine. An individual who can bridge those two camps, the camps of the clinicians who have a prime directive to ensure high quality patient care, and then the academics who are working in a theoretical, sometimes isolated from the direct immediate clinical needs, in trying to design what's the best way to design our educational programs, whether it's for the undergraduate, the graduate, or even in the continuing professional development stream. And understanding those two spheres is where a clinician educator can stand on both sides, grounded in theory, but also understanding the true applications of everyday challenges of healthcare practice. And so as someone who runs an education research unit, but also does full-time clinical shifts in an emergency department and trauma center, I had that unique perspective. So if you are valued to the system, but you don't have enough time, then I think it's incumbent upon you as you develop your arc as a clinician educator to find those efficiencies. And I use kind of a decision framework every time I say yes, because it means I need to say no to something else. Too frequently, the easy default is you say no to your health, or you say no to your family, or you say no to the other things outside of medicine. And you can continue to do that because there's no satiating academic medicine. There's always one more thing to do. So my decision framework looks something like this. I need to say yes to two of the elements before I can say yes to the project. One element, in one corner of the triangle, is what I call my job. It's what I get remunerated for, and it's how I make sure that I have an ability to support myself and my family. In the other corner, or the other angle, I call that my value, or things that allow me to get professional growth. And these could be things like learning something new, or networking, or developing a mentoring relationship where someone will mentor me. So I am somehow, or in some manner, this project is going to give value to me. It's going to allow me to grow and to become a better version of myself. And then the third part, the third angle of this kind of this pyramid, or this triangle, is the importance of the topic. And this is the idea of a cause or an opportunity to really support something that's meaningful. And so I'm always trying to say, can this project to which I'm going to say yes, does it answer two of those three things? Is it my job? Am I getting paid for it? Is it an expectation? Is it part of my employment? But that's not enough to take on something new if it's an additional to some of my core components. And so the next question I ask is this something I really believe in? Is it something that has high value to me that I really want to see move forward? So for me, some of the areas of my own scholarship and research reflect just my own take and my own personal view of the world and how we should work on things. So I try to find things that align to that. Or is it an opportunity for growth? Am I going to learn something? Am I going to develop a new skill or an ability? Am I going to get networked with somebody? So if I can say two of those things yes, then that is the minimum threshold to say yes. So that when I am completing that project, it's not that I'm just doing one more little thing to my overwhelming stack of things. I'm finding that it's delivering to me in two of those three areas on which I make that decision matrix. Really what we're trying to think about is, can we improve efficiency? Really what you're looking for is, in your life, what is there that you can eliminate that's redundant? What's there that you can automate? And with technology and with resources that you may have as a clinician or as an academic clinician, there's lots of resources that may come into play. And what's there that you can delegate? And so if you can figure out how to eliminate, automate, or delegate, then that frees up bandwidth for you to take on those projects that you want to hit two of those threes: remuneration, growth, or value. And when you're choosing something that does multiple things like that, then you are seeing a return on your time, a return on your intellectual capacity that's really worth it. To my busy life, is there something that's going to be so meaningful to me that I'm not only going to serve a project that I believe in, that I have high value, that I think really serves society or my patients, and will I also get something out of it personally? A new network, someone who's going to mentor me, maybe learn some new skill set. I can't say yes to that. It's hard for me to take it on.